Coverage loss and transitions. In the United States, health care coverage can and will be affected by life changes. Coverage can shift or be lost by leaving a job, moving, getting married or divorced, losing a partner or spouse, enlisting in the military, getting older, an increase or decrease in income, or bringing a baby into the home. For example, after age 26, children can no longer remain on a parent's private insurance plan. Due to the way the U.S. healthcare system works, people can easily lose coverage due to missed notices or paperwork, complicated rules, policy, or eligibility changes, or because a plan is no longer available. When coverage changes, it increases the risk of gaps in coverage. Even short gaps in coverage can mean not being able to get necessary medical care, huge medical bills, worse health, emotional stress, major money problems, or any combination of these. Let's take a look at several common ways that people lose coverage. Someone may lose their employer-sponsored coverage after reducing their hours, switching to contract work, or losing their job altogether. If they resign or are let go from their position, COBRA may be available. COBRA allows a person to keep the same employer-sponsored plan for a limited time, typically 18 months or less. However, the now ex-employee is responsible for the full cost of the premium. Since the employer is no longer paying any portion of the premium cost to the former employee is usually much higher. COBRA can provide short-term protection, but the price can make it difficult to maintain coverage. Marketplace coverage can be lost if premiums are not paid or if renewal steps are missed. It may become too expensive, especially if income or policy changes reduce discount savings. Premium tax credits, also known as premium subsidies, and cost-sharing reductions are based on estimated yearly income. If income rises or falls, the amount of financial assistance can change. Coverage can also be disrupted if insurers leave the market or discontinue certain plan options. To maintain coverage, people may need to switch plans, doctors, or networks. People with Medicaid may lose coverage when eligibility rules change, income increases, or renewal paperwork becomes overly burdensome or is not completed on time. Some people may remain eligible but lose coverage because of missed forms or deadlines. Cycling on and off coverage within short periods of time is a pattern known as churn and reduces access to care. Coverage through Medicare is also subject to rules, regulations, and qualifications. Americans generally become eligible for Medicare at age 65 or sometimes earlier due to disability or kidney failure. Medicare has specific guidelines on when a person can enroll in or make changes to coverage. Missing those deadlines can mean no coverage for all or parts of Medicare and/or penalties that can last a lifetime. Some people may also lose eligibility for programs that help lower Medicare costs if their income changes or if they fail to complete recertification steps. Most employer-sponsored, Medicare, Marketplace, TRICARE Prime, and TRICARE Select plans have an annual open enrollment period. The dates can vary depending on the type of coverage, employer, or government regulations. Outside of the open enrollment period, signing up for coverage is usually limited. However, certain life events can create a special enrollment period. These events may include getting married, having a baby, retiring, or losing job-based insurance coverage. A special enrollment period provides a short window to enroll in new coverage or make changes to an existing plan. These windows do not last long. If the deadline is missed, it may be necessary to wait for months until the next open enrollment period. For new hires, employers can require a waiting period of up to 90 days before coverage starts. If one type of coverage is lost, alternatives may exist. Go to asclepiusinitiative.org and click on Educational Materials for information on Medicaid, Medicare, Marketplace, and military-affiliated programs. Gaps in coverage can cause stress and harm to health and finances. Without insurance, people may delay appointments, fail to follow through with recommended tests or follow-up, not take their medications as directed, or hesitate to seek emergency care. Any of these responses can worsen health outcomes. Without health insurance protections, an accident or medical event, such as a heart attack, can cause medical debt that takes years to repay or even result in bankruptcy. Most people in the United States get health coverage through their jobs. This can make it harder to change jobs or to work in fields that do not offer insurance, such as independent musicians and artists. It also creates risk. If someone loses their job, becomes too sick to work, or goes through a major life change, their coverage may end. When that happens, access to care can also be disrupted. The need for health care does not stop when employment changes. When coverage is not guaranteed and access to care is not assured, physical health, mental health, and financial well-being suffer.